Hello everyone, welcome to your Medicare Monday. Today I just wanted to talk a little bit about open enrollment, Medicare's open enrollment from January 1st to March 31st, Medicare and physicians and getting seen by different providers. And lastly, we'll go over just a short review on the Inflation Reduction Act and how that affects Medicare. And then if you wanted to check out my other channel, which I have started putting all my investment related content, you can go ahead and check that out too. It would all be the link in the descriptions below. So for Medicare Open Enrollment, that is basically for people who have a Medicare Part C plan / Medicare Advantage plan. They have a one-time chance to make a change. Let's say, for example, they forgot that open enrollment or annual election period was during October 15th through December 7th, and they auto-renewed into the same plan, but they wanted to change. This would allow them to change then, or perhaps your provider left, or some unknown reason that you need to change your Medicare Advantage plan. You have a one-time shot to change if you have a Part C Medicare Advantage plan. This doesn't apply to anyone who has a Medicare Supplement plan or a Part D prescription drug plan. So if you are a Medicare Supplement Plan member and have a Part D drug plan, this period has nothing to do with you at all. If you are someone who is looking for a Medicare Supplement plan and you have a Part C plan, you can during this time though opt to enroll and get underwritten for a Medicare Supplement plan, and then go ahead and then use this period to choose a Part D plan, which will kick you off your Medicare Part C plan. So that's pretty much all this period is for. It's not for everyone, it's just for people who have a Medicare Advantage plan or want to switch from Medicare Advantage to a Medicare Supplement plan. Next, most office-based physicians will accept new patients, including patients with Medicare. So there's a lot of talk about how a lot of providers are not accepting patients. Well, that's not true based on the study that the Kaiser Family Foundation had done. This is back in May of last year, so it is about 8 months old, but it is the most current research that we have based on whether or not you can see providers. And it looks like regardless of your medical insurance situation, there are more providers than there were before who are accepting patients with Medicare, at least within the office-based physicians. So it's not going to be your physicians that are based and working with like a hospital system. This is more likely going toward the private office physicians. The last thing I wanted to cover is the prescription drug provisions in the Inflation Reduction Act from last year. I did a few videos on this, but just so that you have kind of a overview, this right here, I think you can see all of it, yep, is how, or the kind of bullet points and everything that is changing. Cost sharing for all vaccinations, adult vaccinations that are covered in the Part D, will be at no cost, so long as you use the providers that are within your Part D plan or your prescription or your C plan, your Medicare Advantage plan. In 2024, there'll be a maximum, well, they won't call it a maximum out of pocket, but you can reach what's called the maximum spend threshold, which will be when you enter what's called the catastrophic phase. So standard Part D, you have your initial period, your deductible, then you have your initial coverage phase, then you have the donut hole. In 2023, you have the catastrophic phase, which means you'll pay 5% of the drug medication versus paying 25% in the donut hole. 2024, that goes away, right? And then in 2025, all of this, those three phases, have a maximum out-of-pocket responsibility. So the most you can pay for that during those 3 periods is going to be $2,000. So that's the major thing that's changing. They're also going to limit the increase in Part D premium increases from 2024 to 2030. So currently, the Part D national average is roughly $35 a month. So if your plan costs less than that, that means that you are someone who doesn't spend, or you spend below the national average on Part D drug plan premiums. If you have a more expensive plan, then you are paying for more coverage than the national average. And that's all that it means. So hopefully next year it will be far less as far as the increases. Therefore, there'll be not too harsh fluctuations, because like I said in many of my other videos, how I think one of the ways that prescription drug plans are going to combat this, maximum out of pocket, and the fact that the insurance company is now going to have to pay a lot more money, is they're going to increase the premium cost. So hopefully this helps with all of that. Now I have opened up a third, well, it's like my fourth channel, but another channel that I do actually work on, where I talk about investment and stocks and also strategies that different investors utilize. And if you were interested in those things, I won't be posting it anymore on this channel, because this channel is primarily, I feel, focused on things like Social Security, Medicare, maybe the occasional 401k plan design change, updates, legally, and what's going on through Congress. But as far as like, stocks and investments, those stuff will be switched to my other channel called Investment Inspiration, and that video will have that channel will have videos that will be posted, regularly, more regularly even than this channel. So I hope you tune in over there. If you had any questions for me here, be sure to let me know about Medicare, Social Security, 401k, and other retirement planning topics. But if it's more investment wise, hit it over to that channel. All right, you guys have a great rest of the week, and I'll see you in the next video on Friday.